listener production.
Hey, Chris Spyrou here. Welcome to The Briefing. Since the 1950s, we here in Australia have been adding fluoride into our drinking water. According to our National Health and Medical Research Council, it's an evidence-based practice, and it's helped reduce tooth decay in children by 26 to 44% and 27% for adults. But what would happen if we removed it completely? That's something Donald Trump's pick for Secretary of Health says will be recommended on January 20 to all US water agencies, the same day Trump takes back control of the White House. That pick is Robert F. Kennedy Jr., nephew of US President JFK and former Democrat turned independent, who's often been labelled a vaccine skeptic and conspiracy theorist. He claims that fluoride is associated with a raft of medical conditions, including arthritis, cancer, and lowered IQ. That last one, lowered IQ, is something that's gained traction after a recent US government report found a tentative link between high levels of fluoride in water with reductions in a child's neurodevelopment. Now, the World Health Organization backs the fluoridation of waters as safe, provided it remains within their set limits of 1.5 milligrams per litre. In Australia, our regulations are quite similar but slightly more tight, with safe drinking levels maxed out at 1.1 milligrams per litre. But with this new report and all the suggestions coming out of the US, is it time that we rethink it all? Joining me now to unpack it all is Dr Brad McKay, GP and author of Fake Medicine, Exposing the Wellness Crazes, Cons and Quacks Costing Us Our Health. Dr Brad, thanks for being here. First up, how exactly does fluoride protect our teeth?
Yeah, so fluoride, if it's in our water supply, for example, or if we're using it in our toothpaste, it ends up getting incorporated into the enamel of our teeth, provides a bit of a protective shield, and protects our teeth from being degraded by bacteria and sugar and all of the acid that's in our food. It's very integral to that, keeping that structure of our teeth and preventing us from getting cavities.
And look, according to recommended levels set by the World Health Organization and the Australian government, if fluoride is at the recommended level when it's added into our drinking supply, you're okay. What happens if it's above the healthy limits that have been set by these organizations and governments?
Yeah, so we've seen cases throughout history where the fluoride in the water has naturally been really high. So the first case that was really sort of documented was in Colorado Springs over in the States. And what they found was that a lot of the kids that were growing up, so being born in Colorado Springs, were getting brown teeth. So it was affectionately known as Colorado brown stain, the best condition that you could possibly hope to have. And so all of these children were growing up with permanently brown stains on their teeth. So apart from that, they weren't noticing any major problems with their cognition, with their ability to function at school. There weren't any other major ramifications from that. It was just that they looked a bit different compared to the rest of the American population. And so this is when we really came along and thought, well, what is causing this to happen in kids? And also found at the same time that these children weren't getting cavities. So their risk of getting dental decay and disease was incredibly low compared to the wider population.
The reason that we've got you on the show at the moment is to talk about a recent report that's come out of the US. They've collated studies from Canada, China, India, Iran, Pakistan, and Mexico. And what they've found is that high levels of fluoride exposure, so above those standards set by the World Health Organization and by US officials, can lead to lower IQ in kids. Now, that's something that's been weaponized in a way by RFK and some other people on the political right to pretty much mount this argument that fluoride shouldn't be added to our drinking water anymore. What's your take on that?
So I suppose with the study that came out recently, it's still very early. And in medicine, in science, we bandy around these ideas, we argue about it a lot. And so there's a lot of criticism of the study, saying that some of the studies that were used for this meta-analysis, or an overall study, looking at all of the individual studies, that some of them shouldn't be included. And that if we're getting a bit of a mild change, is that a real change, or is that because we've used poor studies as part of our complete data set? So I think if we're getting a very soft signal, and then if some of these studies aren't actually found to be done judiciously, then this would be a big problem as far as science is concerned, but not a big problem as far as fluoride is concerned. So I think low signal of effects, and maybe low data quality at the moment. We'll see how that plays out. But from 75 years or over 100 years of research of fluoride in people's water, we haven't sort of seen major effects for cognition or problems with kids. So what we do find out is that if people have dental disease, if they have dental decay, then that can also be quite distracting if you're trying to learn at school. It can also be very costly for your parents. And we know that people who are living in lower socioeconomic areas who may not have the funds to go and get their teeth cleaned or use fluoride toothpaste all the time, they're more likely to get dental decay. So by putting fluoride in the water, it actually protects a lot of the people with lower socioeconomic status and prevents them from having very costly dental bills and all the problems that go along with having kids with dental decay.
And I actually really like that you kind of mapped out sort of the causation there. But if we were to believe these reports, and I know that they are preliminary and they have indicated that further research is required, but if there was a causal link between overconsumption of fluoride and lowered IQ, that would be something that would raise alarm bells in the medical field, wouldn't it?
I suppose the issue here is really the dose. So with the studies, they're looking at that higher level, so higher concentrations of fluoride that are contained within the water. Everything is dependent on the dose. So for example, if you're brushing your teeth and then spitting out the fluoride that's been in that toothpaste into the bowl, that's very different from eating the whole tube of toothpaste or spreading it out in your toast in the morning. So very different things that we're talking about. There's definitely like a safety buffer as well. So we sort of set our level of safety at a very conservative level across the world. So we sort of say, we want to keep the level of fluoride at less than 0.7 milligrams per litre of fluoride in the water. So we know at the moment that if you're getting up above like 1.5 milligrams of fluoride in 1 litre of water, then that could start to cause the fluoridosis, so teeth staining, and potentially other problems that we've talked about. If we do keep it at that low level, we're very unlikely to run into any problems, but very likely to help people's teeth.
And is there any way that anyone who's listening to this episode right now, is there any way that they can know that the water that they're drinking is within the recommended levels?
Yeah, so if you're in Australia, then you should be having the levels of fluoride tested in your water all the time. So there's very high sort of regulation regarding that. If you're in rural areas, it could be a little bit difficult. It may not be tested all that frequently or all that often. We are relying on our government to sort of make sure that those levels are kept appropriate. So certainly looking at the results from your local council and making sure that things are above board. We hope that they are.
Which is a perfect segue to, an Australian case that caught my attention. We know of 2 rural communities at the moment in the Northern Territory that, as of last month, they were being sent bottled water as their fluoride levels in their drinking water was above the standards set by the World Health Organization and national standards. For context, they were 65% above the national maximum. Importantly, this was something that was naturally occurring and wasn't something that was caused by the Water Authority adding more fluoride to their drinking water. The interim solution there was to send these people bottled water, but what can everyday people do if they're concerned about the levels of their fluoride in their drinking water?
So if you're in a well-established area, in a city, for example, and there's very low fluoride in the water naturally, and the government is adding in a tiny amount into your drinking water, then I wouldn't say that you have anything to worry about at those minuscule levels. But what we're talking about in the Northern Territory and these communities is that it's naturally occurring. So the fluoride is leaching out of the rocks, the area around the surrounding area, and then going into the water supply and then being in those high levels. And so we want to be keeping the fluoride lower than 1.5 milligrams per litre. And I think some of the levels were being found about 1.7 milligrams per litre. So a little bit above what we'd be happy with, knowing that there's a bit of a buffer that we'd kind of want it under about 0.7 really to be at that sweet spot. So what we have here is that there are higher levels that are naturally occurring in people's water supply. And one of the issues that people are up in arms about is that they weren't really told. So the government was sort of testing water for a while, finding that there were naturally high occurring levels of fluoride and not decreasing the amount of fluoride in the water. So this could potentially be a problem for children if we're getting over those levels, so over 1.5 milligrams per litre, that could potentially have problems. And so that's why they're sort of like bringing bottled water into the towns, just to be on that safe side of things as much as possible now that they're taking action.
Yeah, and something I want to return to that you spoke about earlier was toothpaste. One of the key arguments that RFK Jr. is bringing up is that the amount of fluoride in toothpastes and mouthwash at the moment is adequate to address these issues around teeth and that it doesn't have to be added to the water supply. What's your take on that?
Yeah, so back in the day, back in 1945, when fluoride was first introduced into water, Grand Rapids in Michigan in the States, what they found from studying the children over a period of about 15 years is that the amount of dental decay that was occurring in those children decreased by about 60%. So quite a significant amount. So some of the studies that are done these days sort of suggest that maybe it decreases the amount of dental decay by about 25%. So those figures are sort of like decreasing. And so what we're sort of like finding here is if you're vigilantly like brushing your teeth twice a day with fluoride toothpaste, if you're being very careful and brushing and using toothpicks, all of the dental care that we have available today. Sometimes there's fluoride that's added to salt. There's fluoride that's added to milk in some places of the world. All of these sort of strategies can sort of be helpful. So you don't necessarily need to have that in the water. But what we find is that if you're living in a lower socioeconomic area, that if you don't have access to fluoride toothpaste, if you're not able to go to the dentist and have fluoride treatment twice a year on your teeth, then you may not be able to take care of your own teeth. And so it's these people that are vulnerable. So by putting fluoride in the water in very low amounts, it is a bit of sort of equity in healthcare. So we're able to provide benefits for people who have the lowest incomes. So they're not spending a lot more at the dentist or just pulling out teeth and having trouble eating when they're older. It sounds lovely that we maybe don't need to have fluoride in the water, but that's great if you're really privileged and if you're speaking from a place of privilege. If you're living in a lower socioeconomic area and you don't have the funds, then that is a big problem.
I do want to bring it back to the US politics and RFK a little bit. Generally, his line on this is that people deserve to be informed and that competing medical research shouldn't be shut down but tabled and discussed. So ultimately, allowing people to decide, he says that's democracy in action. With the reports on the table right now, and I know we spoke about that US report, what's your message to anyone who might be questioning or a little bit skeptical about drinking water from the tap at the moment?
I think he's described on Wikipedia as being a conspiracy theorist, and it's like that's part of the top of his bio. So like the issues are like he's known to travel over to Samoa and talk to a lot of people in the anti-vaxxer nation community, and then discourage people from using the MMR vaccine. And then after he left the country, then all of these young kids got measles and lots of people died. So it sort of like has these awful implications. And the issue is if you're like just asking questions and trying to break the status quo, and that's changing people's health behavior, but that behavior is based on lots of research and lots of interventions from public health, then that's a major problem. So you're just asking questions, fine, but if you're in a position of power, it actually can cause major ramifications for people's health who may be quite innocent and vulnerable. At the moment, we've had like over 75 years of sort of like very formal investigations into fluoride. We haven't found that there's been major problems from it. If the government is putting fluoride in the water, at least it's controlled and in very low amounts. I'd be more concerned if it's naturally occurring in higher amounts and unregulated. That would be more of a concern where you're more likely to have problems. But certainly, we know that we have less dental disease if it is in the water. We haven't seen problems with other issues for people's health at the levels that we're using. So I think that we do have a safety feature. We've got a buffer before we're sort of like reaching problems. Up here, I'd be a little bit more concerned at high concentrations. But if we're really at the levels that the government is putting it into the water generally around the world, then I wouldn't have any problems with that. It's just the poison is in the dose, and the dose is so small.
And look, my very, very last question for you is, if for whatever reason someone's gotten to the end of this episode and they're like, you know what, Dr. Brad, I'm not convinced. You haven't convinced me that I should be drinking tap water. What are some everyday things that someone listening to this podcast can do if they are concerned about the levels, even though they're quite small, of fluoride in their water?
One of the answers to that is, if you're wanting to avoid fluoride in your tap water, you can drink bottled water. I suppose it would get very expensive very quickly. That's one option. But certainly, if you're looking at some of the reports from Calgary, they ended up taking fluoride out of the water over in Canada, and so they're planning to put it back into the water because everyone's teeth are falling apart. And I think if fluoride is taken out of the water, and if RFK Jr. Is correct, and if fluoride is just banned from the water on January 20th of 2025, then it will be an amazing experiment to see what happens to Americans' teeth across the next decade or so. So that's probably one of the best ways of really judging this amazing science experiment that's going on due to American politics at the moment.
We're in this weird place where America's kind of become the experiment for a lot of things at the moment. So watch this space.
Yeah, we'll see what happens with vaccines and and everything else on RFK Jr.'s mind.
Yeah, it's terrifying and a little bit exciting. Dr. Brad, thank you so much for joining us on The Briefing.
Thanks for having me.
Dr. Brad McKay, GP and author of Fake Medicine there. Thanks for listening to this episode of The Briefing. That's it for now. Before you go, though, we'd love it if you could share this episode with someone who you think might enjoy it. If you want to keep up with our other content, you can. Check us out on Instagram at The Briefing Podcast, and on TikTok and YouTube, search Listener Newsroom. And we'll be back in your feed with another episode tomorrow morning with Sash for the headlines. I'm Chris Spyrou. Catch you next time.
Listener.